U.S. health officials expect the number of monkeypox cases to keep climbing for at least the next few weeks. The virus has been detected in nearly every state with more than 1,800 cases reported. But health experts believe that number could even be higher, and there are not enough vaccines to keep up with demand. Tanya Rivera reports.
Good morning, Vlad and Anne-Marie. New York City has become the epicenter of this outbreak with more than 450 confirmed cases. Demand for vaccine is so high, the city opened 3 more mass vaccination centers Sunday, but due to limited supply, they were set to be open for only 1 day. Long lines formed outside clinics from New York to San Francisco this weekend as the nation's vaccine supply struggled to keep up with the monkeypox outbreak.
We need more vaccines quickly.
The government recently made another 131,000 doses available to states and ordered nearly 7 million, but most of those won't arrive for months. On CBS's Face the Nation Sunday, former FDA Commissioner Dr. Scott Gottlieb warned time may be running out.
I think the window for getting control of this and containing it probably has closed. And if it hasn't closed, it's certainly starting to close.
John Ferry became eligible for a vaccine last month after coming into close contact with someone who had monkeypox. He says actually getting a shot was difficult.
I was told to call, 311 New York and discuss with public health. I kept hitting dead ends. And when I finally did get access to the vaccine, it was unfortunately just too late for me.
His symptoms appeared the following day.
I developed pockmarks on my face, on my chest, on my hands.
The virus mainly spreads through skin-on-skin contact, and symptoms include fever, body aches, chills, and fatigue. Many who have been infected have developed painful lesions, but no one in the U.S. has died. To understand the full scope of the outbreak, health experts say testing also needs to be ramped up and expanded beyond gay and bisexual men, amongst whom the virus has so far been primarily spreading. Anyone can get the disease.
It's a fact that there's cases outside that community right now. We're not picking them up because we're not looking there. This has spread more broadly in the community. I wouldn't be surprised if there's thousands of cases right now.
The CDC is looking to expand testing capabilities and possibilities beyond the current tests, which are conducted on the lesions that form from monkeypox. Most people who contract the virus fully recover within 2 to 4 weeks, and there are no lasting effects. Vlad and Anne-Marie?
All right, Tanya, thank you very much. So joining me now to talk a little bit more about this is Dr. Celine Gounder. She is the editor-at-large for public health at Kaiser Health News and an infectious disease specialist and epidemiologist at NYU Grossman School of Medicine and Bellevue Hospital. I said joining me, but I meant us.
Yes.
I meant us. So let's talk a little bit about this. Dr. Gounder, you heard what Dr. Scott Gottlieb had to say. I want to play a little bit more of what he had to say on Face the Nation, and we can talk about it.
You're saying this is a pandemic. That's not a word the administration's using yet. What level of emergency are we at?
Yeah, look, and I think they're going to be reluctant to use the word pandemic because it implies that they've failed to contain this. And I think at this point, we've failed to contain this. We're now at the cusp of this becoming an endemic virus, where this now becomes something that's persistent that we need to continue to deal with.
I mean, pandemic? To me, a pandemic is something with much larger numbers. Right. What's your take on it?
This does meet the definition of a pandemic, which is that you have a novel virus. So outside of Western and Central Africa, this is a novel virus for us, spreading throughout the world in large numbers. So you have it in North America, South America, Asia, Europe, Australia. So it is spreading as a pandemic. But it's important to understand this is not COVID. It is not transmitted like COVID, but it is a pandemic.
Wow.
So the CDC expects these monkeypox cases are going to continue to climb through August. And we were saying this earlier, Anne-Marie and I, have we learned any lessons from the COVID-19 pandemic that we can apply here? Because when you hear people in Tanya's reporting that say, I didn't know where to get a vaccine, I couldn't get a vaccine, I called 311, no response. I mean, that makes me worried that it's not just monkeypox. What if there's another Ebola infection scare that happens here?
Public health departments are coming out of the COVID pandemic weaker than they've ever been. They've really taken a beating. People are exhausted. And what would it look like to learn our lessons? It would mean investing in public health, expanding your workforce, putting money into those data systems instead of faxing numbers. And we just haven't done that. So that's what it would look like to actually learn. And unfortunately, we have these cycles of investing money during the emergency, and then we don't build things up afterwards.
Yeah, and I think if there's one thing that we did learn during COVID is that the CDC is an organization that actually was never set up to deal with a pandemic the way we had to deal with COVID, which was sort of like a massive campaign.
Right.
They're about research and collecting data and giving, advice and testing and that sort of thing. So that brings us back to monkeypox. And just so people can kind of understand, because it sounds scary and the images look scary, the difference between COVID, which we seem to not be able to sort of reel in, and monkeypox. They're two very, very different things.
Yeah, they're very, very different viruses. So COVID is a virus that predominantly infects your upper airway, your lungs, causes a pneumonia. Monkeypox is also spread differently, so it's infecting the skin, it's infecting inside the mouth, inside the anus, genitalia, and it's spread through skin-to-skin contact because that's where the infection is. With COVID, because it's in your respiratory tract, you're spreading it through the air. So they're spread differently. Where you're affected is different.
I might have read this somewhere, doctor, but correct me if I'm wrong. If you were born before 1975, you may have received the vaccine and you are thus protected from from monkeypox because I received, maybe you did, the smallpox vaccine when we were children. Yeah,
that's right. So we declared smallpox eradicated around the world in 1980. Depending on where you were living, up until the late 70s, you may well have received a smallpox vaccine. We stopped vaccinating here in the U.S. a little bit earlier, but if you did get that smallpox vaccination, you probably have this round scar on your upper arm. You are probably pretty well protected against monkeypox still.
Well, that's good news for some people. So we're still let's talk COVID now. We're still dealing with this new subvariant. It's called BA.5, the Omicron subvariant, that seems to be more resistant to COVID-19 vaccines. This is really worrying, and a lot of people are also starting to worry about long COVID. And I have a question. If you were infected with COVID-19 before the vaccines were available, and before the boosters obviously were available, are you more susceptible to long COVID than if you were infected with COVID-19 after you were vaccinated and boosted?
We don't have a clear answer to that. There is some data that shows if you've been vaccinated, it does reduce your risk of developing long COVID, but there's still a lot we don't know about long COVID. It really is a cluster of different syndromes, probably each slightly different cause, and will require different treatments.
Yeah, one of the things I saw in a report, actually Jean Lepouk had a report this weekend on Sunday morning from the NIH that, these symptoms that people are indicating that they have from which they believe come from COVID are so wide and varied, it's hard to treat for them. How do you treat for somebody who lost their sense of taste? Or how do you treat for somebody who says they're winded after taking a lap around the block when they're just walking, but before COVID they were running marathons? And there's no one way to treat the 200 symptoms that people say that they're indicating.
I think it's fascinating because I think it feels a lot like some of these autoimmune disorders that doctors really don't know how to categorize. The symptoms look like a variety of other things. And maybe ultimately what will happen is we'll gain a better understanding about how to manage symptoms, not just for people who are dealing with long COVID, but for some of those other kind of autoimmune disorders that are very similar.
Yeah, take, for instance, chronic fatigue syndrome. We don't really know what causes chronic fatigue syndrome. It's hypothesized it might be related to a viral infection or maybe multiple different viral infections. But again, it's similar in that you have these symptoms. We don't know what to do with them. We can't make them go away with a treatment. So we're really stuck just managing each of those symptoms individually.
It's really wild because they will say that you can find in people who've had COVID-19 evidence of it in their stool samples, but they don't test with a PCR. They don't have COVID, but it's still in the body. That's wild and scary.
Well, another indication of what the doctor said is that there's so much we don't know. Right?
Dr. Gounder, always great to have you. Thank you so much as always. We appreciate it.